There you go.
Being diagnosed with any type of chronic illness can be frightening and overwhelming, but having a disease that you can't physically see adds a whole nother level of uncertainty to the situation. When a friend or loved one is diagnosed with a disorder, it's easy to feel helpless, but having a basic understanding of their disease can help you understand what they're going through and also helps you help them cope better with their disease. My goal today is to bring awareness to my audience about Crohn's disease by informing them on the symptoms, treatment, and management of this illness. Two conditions fall under inflammatory bowel disease, and those are ulcerative colitis and Crohn's disease. According to the Crohn's and Colitis Foundation of America, 1.6 million American people are affected by this disease, including several of my family members. According to the textbook Medical Surgical Nursing by Sharon Lewis, Crohn's disease is an inflammatory bowel disease. It affects the gastrointestinal tract and it can occur anywhere along the GI tract, including the mouth and the throat. Crohn's disease is a spectrum disorder, meaning that no two people with the disease experience the same symptoms. It can range from a mild to severe form. The first steps to recognizing any disease is by knowing its symptoms. Because Crohn's affects mostly the colon or the large intestines, I'll cover those symptoms. In a mild case of Crohn's, a person can experience as little as a stomach ache or bloating. In more severe cases, people are likely to experience abdominal cramping, diarrhea, and extreme weight loss from malabsorption. Because the intestines are in a nearly chronic inflammatory state, the part of the organ that is affected by the disease can become necrotic or die away. And in severe cases, most people can lose their colons and their intestines will be brought through their abdominal wall to form a colostomy, but I won't get into that because it's not pretty. Treatment of this disease includes harsh, lifelong drug therapy or surgery, and sometimes both. According to the Lewis textbook, 75% of patients with Crohn's disease will require a surgical procedure. Crohn's is a chronic illness, meaning that it's not curable, and treatment alone is not enough to control the disease. Diet plays a major role at its management. As mentioned earlier, no two people are alike. For some, gluten is a trigger for inflammation. For others, greasy food is. For all patients with Crohn's disease, Mayo Clinic suggests avoiding dairy products and other foods that cause gas and diarrhea. Spicy food is to be avoided, as well as high fiber diets, because these individuals are already going to the bathroom upwards of 20 times a day, and fiber will just cause them to go to the bathroom more. The goal of treatment is to make sure that their bowels are rested, and you also don't want them to lose any more fluids than they already are. So a diet that's high in fluid content while avoiding alcohol and caffeine is essential, as well as a low-fat diet. So today, we talked about what Crohn's disease is, its symptoms, its treatment, and its management. My hope is that if any of you have this disease or have a family member with this disease, you'll be better able to sympathize with them and help them cope. A chronic illness is very scary and not something to take lightly, but with proper education and patient compliance, it's very easy to live a normal lifestyle.